Oh my gosh, my teacher just assigned a huge final exam tomorrow on breast cancer. Oh no, not just any type of exam. We need to know every little detail of the cancer. I'm a girl. I'm one of the only girls in my class, and I don't even care about this. Like, it doesn't affect me. What even is it? Cool, you have cancer in your breast. Do I have to spend all my night studying for this now? Time to go lock myself in my dorm and study. Jeez. Hey guys, I can't hang out tonight. I'll be studying the whole night.
We only got 4 minutes to save the world. No hesitating. Grab a boy, grab a girl. Time is waiting. We only got 4 minutes to save the world. No hesitating. We only got 4 minutes. 4 minutes. So keep it up, don't be a break. Hey, Madonna, you gotta get 'em up. Hot. Tick tock, tick tock, tick tock. That's right, keep it up, don't be a break. Hey, Madonna, you gotta get 'em up. Hot. Tick tock, tick tock.
What time is it? 2 in the morning. First of all, I'm never going to be able to do good if I don't get a good night's sleep on this. Oh my god. I'm just going to go to bed now, wake up early and look it over and hope for the best. Oh, jeez.
Anna, wake up.
Did I miss my exam? What time is it?
It's a dream. Calm down.
Wait, I'm in a dream?
You're not going to wake up. But I'm a breast cancer survivor, and I'm here to help you study for your test.
You're a what?
Breast cancer survivor.
So, why are you here?
Because I saw that you were crunching for studying, and I saw your study guide, and I thought I could help you. Who better than a breast cancer survivor to help you study for a test?
You're telling me that you know all this random facts.
Yeah, I had to go through it.
Alright, have at it. I'm all ears.
When I was younger, the doctor diagnosed me with breast cancer. You can develop ductal carcinoma, which begins in the lining of the milk ducts, which are thin tubes that carry milk from the lobules of the breast to the nipple. Or you can develop lobular carcinoma, which begins in the lobules or milk glands of the breast. After this cancer develops, you are at risk of invasive breast cancer, which is when the breast cancer spreads from where it began in the breast ducts or lobules to surrounding normal tissue. There are many ways that you can prevent breast cancer, but since I was at such a young age, it was hard for us to detect. Mammograms, such as the one in the picture, are often used once a year as an X-ray to the breast. This is an easy way to help detect and prevent breast cancer from forming. Women should have clinical breast exams yearly given to them by their doctor. It is also important for them to consistently do self-examinations of their breasts in order to be able to report any changes in their breasts. Some women face a higher risk of developing breast cancer since it runs in their family. Therefore, yearly they usually take mammograms and MRIs of the breast. The most common forms of breast cancer treatment are lumpectomies, which remove the cancerous tumor and some of the tissue that surrounds it. You can also get a partial mastectomy, where the doctor removes part of the breast, including the tumor and then some normal tissue surrounding it. Sometimes the lining of the chest muscles below the cancer is removed in segmental mastectomy. All of these surgeries are breast-conserving surgeries, but a total mastectomy is another option, where both breasts are completely removed. Before these surgeries, patients sometimes choose to undergo chemotherapy, which is given throughout a series of months in order to shrink the size of a tumor. And after their surgeries, they sometimes choose to undergo radiation therapy or hormone therapy in order to make sure that all of the cancer cells that were left behind after the surgery were killed. Sometimes patients choose to strictly undergo chemotherapy as their only form of treatment. Some side effects to taking chemotherapy are appetite changes, bleeding problems, constipation, diarrhea, fatigue, hair loss, memory changes, and nausea. The recovery time for surgeries such as lumpectomies and mastectomies are only 1 to 2 weeks, whereas chemotherapy is a series of treatments throughout months. Women with a higher risk of developing breast cancer also like to prevent breast cancer by getting prophylactic mastectomies, which is a preventative procedure of removing breast tissue in order to prevent the developing of cancer later on in life. One clinical trial that is currently underway in order to try and prevent the development of breast cancer is being tested on Chinese women between the ages of 40 and 60. The purpose of this trial is to evaluate the benefits and risks of hormone replacement treatment among early menopausal Chinese women. Another clinical trial that is currently being studied on women is between the ages of 30 and 75, whom are on tamoxifen therapy for the treatment or prevention of breast cancer and have at least one remaining breast. They are being studied to see whether or not human chorionic gonadotropin, which is a hormone better known as HCG, will result in a decrease in breast density, since high breast density is often linked to the development of breast cancer. Celebrities such as Sheryl Crow and Cynthia Nixon have been diagnosed with and survived breast cancer. The breast cancer ribbon was originally peach-colored, created by Charlotte Haley, but later the Susan G. Komen Foundation created and distributed pink breast cancer ribbons at their Race for the Cure. The color pink represents women and the hope of abdicating breast cancer as a whole. In the U.S., 1 in 8 women will be diagnosed with breast cancer in their lifetime. When I was younger and diagnosed with cancer, I didn't understand the scientific side of it, but now I know. There are 2 genes that produce tumor suppressor proteins. The first one is BRCA1, which is on chromosome 17, and the second one is BRCA2, which is on chromosome 13. They help suppress cell growth. When these genes are mutated, so is their protein product, which damages the DNA. As a result, these cells are more likely to develop additional genetic alterations that can lead to cancer. The mitotic count is very important when observing breast cancer cells. It helps to determine whether the tumor is grade 1, 2, or 3, with 3 being the worst. If there are less than or equal to 7 mitoses per 10 high power fields, the cancer has a score of 1. If there are 8 to 14 mitoses per 10 high power fields, the cancer has a score of 2. Finally, if there is equal to or greater than 15 mitoses per 10 high power fields, the cancer has a score of 3. Women at the age of 30 have a 0.44% or 1 in 227 chance of being diagnosed with breast cancer. Women at the age of 40 have a 1.47% chance or 1 in 68 chance of being diagnosed with breast cancer. Women at the age of 50 have a 2.38% chance or 1 in 42 of being diagnosed. And women at the age of 60 have a 3.56% chance or 1 in 28 chance of being diagnosed with breast cancer. That's enough about me. I'm glad I could help you study for your test, but you better wake up now or you're going to be late. Good luck!
What time is it? Exam morning. Never thought I'd say that with a smile. That girl in my dream last night. Wow. I'm so ready for this test now. I'm so thankful for her. Such a beautiful day to have a test. Oh. Except now I kind of regret what I said earlier. Breast cancer is so much more than cancer in your breast. It affects people in so many aspects of their life. I'm actually kind of scared that I would get it. There are so many ways to prevent breast cancer. Now the only thing I need to prevent is myself from failing out of college. Time to go take that test.
Yo, Anna, you wanna go party tonight?
Party? Probably not. A large consumption of alcohol increases your risk of getting breast cancer. I'm not about that life anymore. Gotta ace this test. Let's go.
Two hours later.
Pizza, cake. Woo! Think I aced that one. Now, I'm about to go prevent myself from getting breast cancer.
Listen up, cause this is it.
I'm about to prevent myself from getting breast cancer.
Delicious definition make them boys go loco. They want my treasure so they get their pleasure from my boat. So you can see me, you can't squeeze me. I ain't easy, I ain't sleazy. I got reasons why I tease them. Boys just come and go like seasons for delicious. But I ain't promiscuous.
I'm not gonna drink anymore. I'm not gonna smoke. I'm gonna eat healthy.